To West Africa's deadly Ebola outbreak. Trials of new drugs are being fast-tracked in the UK to help battle the epidemic. And as CCTV's Richard Bestic reports, work is underway creating a preventative vaccine.
International efforts to curb the spread of the Ebola epidemic appear to be ramping up. Here, a German aid organisation works on the construction of a new isolation centre in the Liberian capital of Monrovia. Chinese medical workers have arrived in Guinea and Cuban medics prepare for deployment. Without international assistance, the World Health Organization has warned Ebola infections could rise to 1.5 million by the new year.
This is exponential increase, with hundreds going into thousands of cases per week. And if we don't stop the epidemic very soon, this is going to turn from a disaster into a catastrophe.
Currently, WHO says Ebola kills around 70% of those infected, and some strains have death rates as high as 90%. Here at Oxford University's Centre for Tropical Medicines, they've fast-tracked trials in an attempt to find a cure. Clearly, if successful, it'll bring down Ebola's horrendous mortality rate. But these are early days. Peter Horby of the university's Clinical Research Unit is to test experimental drugs in West Africa as part of a $5 million emergency programme funded by the global charitable foundation Wellcome Trust.
We have to do something now. It's the only time that we can study these drugs and see if they work and make a difference is to do the studies now. Now, normally a clinical trial would be developed over many years, and we just can't afford to wait that long.
Across the campus in Oxford University's Jenner Institute, they're working on an experimental vaccine. Ruth Atkins, the first volunteer in the British safety trial, has received an injection.
This is a remarkable vaccine trial. Just about a month ago, we had no idea that this vaccine existed or was going to be available for clinical testing.
Ebola has revealed a worldwide weakness in modern medicine. The search for a vaccine and a cure now taking centre stage in the fight against a disease that's raging out of control. Richard Bestic, CCTV, Oxford University, England.